It's ironical. With so much of human resource possibly available, we are actually facing a shortage of skilled manpower, especially for healthcare. Hands that care are scarce. Indraprastha Apollo Hospitals in India today is the busiest solid organ transplant center in the world, with 980 transplants done in the year 2015.
We've just finished the second living donor liver transplant of today, and when I look at the faces of the team who have stood for so many hours and really so tired, but the joy on their face makes me happy. What a great day.
I'm just going to start the third kidney transplant of the day, and this is possible because of the amazing energy levels and dedication of our nursing staff.
To deliver complex care, healthcare systems need to be driven by outcomes that are measurable. At Apollo Hospitals, we measure the clinical outcomes for our 64 hospitals spread across the country through our Clinical Balance Scorecard, ACE at 25, and benchmark them with the best institutions in the world. When a healthcare system is driven by outcomes, it improves staff performance, becomes dynamic and efficient.
The most important challenge we face is how to deploy our skilled manpower resources to cater to the changing volumes of patients. And for this, we developed the Auto Resource Enabler right here at Apollo Hospitals, which helps us to deploy our staff effectively and deliver the best outcomes and quality of care to our patients.
Hospitals are always in a state of flux. In addition to the challenges of high attrition of staff, we are also faced with lack of information on the projected volumes and daily variation in terms of patient. All this was a matter of concern from the angle of staff productivity.
The solution to the problem came as the Auto Resource Enabler, which is a unique set of dashboards which helps to capture the real-time status of nursing staff utilization. This software also helps us predict nursing demand for the hospital proportional to fluctuating daily workloads. It captures the real-time scenario for a patient care unit, such as the number of total beds available, number of occupied beds, number of nurses available. How does the software work? The Auto Resource Enabler is integrated with the admissions module, the nursing roster management system, leave management module, and the daily attendance module. Because of these integrations, the anticipated admissions and discharges are visible to the nurse in charge. When in the morning, the staff physically enter their attendance, the software shows their real-time availability on the nurse in charge interface. Staff is then allocated in the software based on patient-to-nurse ratio. Most importantly, the expected excess or shortage of nursing staff and the resource excess and deficit areas are now visible on the single dashboard, which are then managed. This is the most beneficial feature of the software. The software also depicts the patient-to-nurse ratio prevailing for each area at any given time.
Effective deployment and utilization of resources become an integral part of any leader's job profile. To understand this better, especially in a healthcare situation where things are so complex, what we did is we've tried to use the Flexi Staffing module. This has enabled us to understand the effectiveness of utilization of our staff, areas where there are low occupancy or high occupancy, and how effectively staff are being deployed into these areas. This has helped us utilize our staff better because we've been able to create a lot of modules to upskill and enable newer competencies into our staff, thus helping us multi-skill the nurses and redeploy them into areas where there is need. What we are really proud of in this hospital is to enable our clinical outcomes. The focus on the tender, loving care that the nurses provide, the high touch is what our patients speak about, and we're really proud of our nursing staff who are the first line of contact providing the tender loving care for our patients, thus creating a home away from home.
With this simple software, a total of 120 nurses were found surplus in the system. We saved 37,000 euros by judicially using the manpower and not recruiting more nursing staff at the same time. Optimal patient allocation by the software ensured that the nurses were not overworked or overburdened, hence improving the quality of care delivered. Post-implementation, the rate of patient falls reduced by 71%, pressure ulcers by 60%, and medication errors reduced by 45%. Patient satisfaction rates improved by 13%.
The intelligent use of technology can free up some very valuable time for the clinical team. We must always remember that as we become more and more high-tech, we must also remain high-touch. In our endeavor to excel as clinical caregivers of the body, we must never forget that we must also become good caregivers of the soul. At the Apollo family, we've kept it relatively simple. Whenever a healthcare professional joins our large family, we request him or her to treat every patient as a relative, as a family member. And we expect them to treat that individual, that patient, just as they would expect their spouse, their child, their parent, their uncle to be treated. Nothing more, nothing less.